Hi friends. Now, in view of the evolving nature of the exams and how the exam is conducted today and how the next exam would be coming in future, the DAMS team has been working on the background for the last few months and we have been able to create some wonderful courses. Now, we are launching today a course for surgery practical for final prof exams. In this, we have actually created actual patient videos on things like thyroid swelling, for the lump examination, the eye signs, the salivary gland swelling, ulcers, breast examination, prostate, hernias, hydrocele. Like we've created a full-fledged course where we are covering how to really examine these patients in the exam and what to present in the exam, what are the relevant points in the history, what not to miss. I believe, to the best of my knowledge, this is first such course for an undergraduate in India on a video platform, and this will be available on eMedicoz for all our foundation students this year, and for subscription as well for people who have not joined us. They can, actually subscribe to this course just before the exam. I believe it will be a game changer for you if you are going for a surgery practical exam with all the relevant information in one place, crisp, concise, and I believe that we will be able to make a difference in your journey for all kind of things that you have to appear in the exam, be it MCQ, be in practical. We want to be the part of your journey. We sincerely believe medical education should be done in a more conceptual, more integrated manner, and this is one of the things that we have done. And for those of you who do not know, we have huge response to the ophthalmology practical course that we've launched on eMedicoz recently, which is one of the best selling course on the app. So make sure that you utilize this. All DAMS Foundation students, this is a gift for you from my side. I wish you all the best.
Hi friends, this is a module or a course for clinical examination which tells you the scheme of clinical examination for different types of cases encountered in the surgical practice. This will be extremely helpful for practical examination because we are discussing the method to approach patients with different surgical problems, which includes the history, what are the important points or the features, the points to be taken in the history, what is the scheme of examination, what are to be examined, plus very importantly includes a video showing the examination of the patient with that particular surgical case. So this module is going to include, starts with the examination of a swelling in general and examination of an ulcer, because on the two most common cases which you find in surgical practice. Then we go on to approach to a patient with a breast lump, where we include the history, examination, how to make a diagnosis and how to investigate the patient. Approach to a patient with thyroid swelling, approach to patient with hernias, which include groin hernias as well as the different types of ventral hernias. Approach to patient with scrotal swellings and their differential diagnosis. So different important scrotal swellings, salient features have been discussed, how to come to a diagnosis and what can the different differential diagnosis of scrotal swellings. Examination scheme for the abdomen and abdominal lump with discussion of the region wise differential diagnosis and features on examination of the important abdominal lumps which we get in our clinical practice. Approach to a patient with peripheral vascular disease with approach to a patient with a diabetic foot. Apart from this, it also includes approach to patients with varicose veins and venous disorders, approach to the patient with salivary gland swellings, approach to patient with stomas, ileostomy and colostomy, and lastly approach to patient with benign prostatic hyperplasia.